But first, let's talk about what I see in my clinical practice. I see the overuse of buckets or containers to hold babies. Does anybody know what I mean by that? Everybody's in a car seat, or a holder, or a special thing to sleep. Sometimes that straps you in place while you sleep, right? Doesn't seem natural to me. The overuse of swaddling, pacifiers, and the obsession with sleep training. If anyone is on Instagram, every other account for parents is a sleep trainer, right? We care more about how our baby is sleeping than anything else, which is kind of ironic considering if we're sleep training them, they're probably not going to be developing good sleep habits. But okay, infants are on medication to treat colic and reflux. Why do babies need medication, right? That's crazy. Like, there's got to be something, like, why? They keep asking why. What's wrong? And instead of asking what's wrong, we give them a pill, right? Of course, I see tethered oral tissues such as tongue and lip tie. And again, I could talk about that for, about 8 hours, and sometimes I do. But for now, know that that's going on, and it's going on in higher numbers. And Dr. Siegel will talk a lot about that. So there's a whole new population of children or of infants that are having difficulty breastfeeding because they have structural anomalies in their mouth. I see a lot of torticollis. I'm sure you guys see that a lot too. Plagiocephaly, and inability to be comfortable in tummy time. Basically, I see kids or babies that aren't integrating their primitive reflexes, maybe because of how they're being held or where they're sleeping, or how they're being fed or overfed. 60% of parents do not reach their breastfeeding goals. And, as I said before, you know better, you do better, and nobody should feel anything negative about what their breastfeeding goals are. I'm not here to judge anybody. Even in my own practice, I don't just see breastfeeding families. I see bottle feeding families, mixed feeding families. I'm often recommending formula for babies who need that extra help. But before a baby is born, about 80 to 85% of women, even on our island, say they plan to breastfeed. But nobody learns how. And they're not making it, right? So if 80% say they want to breastfeed and they leave the hospital, only 25% of them are breastfeeding at day 2, chances are they're not making it very far. So they're not meeting their own goals. And why is this? This is a list that I actually got from an article. I could tell you why I think, but this is an actual research study. And all my references are here for anybody who wants them at the end. Issues with latching. And latching could be pain, inability to open their mouth to latch, unable to move the tongue to extract milk, swallowing difficulties. And majority of these issues, but not all, are related to tongue tie. Concerns about making enough milk. Concerns about making enough milk isn't actually not making enough milk, right? Because only 1 to 2% of the population, when supported, will actually not be able to make enough milk for their babies. There's some people that are saying that that's rising with the health statuses of moms today, but in general, most people can make enough milk if they are supported and if the baby is with them and there's nursing or pumping or supported, or they have a lactation consultant supporting them. Concern about taking medications while breastfeeding is a big one, right? And in my group, that's the biggest question. My doctor prescribed this and told me to pump and dump. And I get all, no, you don't have to pump and dump. Most medications are safe with breastfeeding. The problem is that many physicians and pharmacists don't understand how breast milk filters medication and what it has to do with molecular weight and the fat content, and if they're fat soluble or water soluble, or how big the proteins are of the medication. So most medications are safe for breastfeeding, but most women put on any kind of medication, even a medication that would be safe to directly give to the baby, are told not to breastfeed. So then after a couple of days of taking a medication, sometimes longer, it gets harder to get back to breast, and most don't. Unsupportive work policies. Most states have laws regarding pumping at work, but without paid family leave and other protections, this remains a challenge. The cultural norms and lack of family support. Michelle and I were chatting before about, culturally on Staten Island, we are not a breastfeeding culture. And interestingly, we did a study at Staten Island Hospital while I was there, and if your mom did not breastfeed and you live on Staten Island, you only have about a 20% chance of breastfeeding. And the inverse is true. If your mom did breastfeed, you have an 80% chance of successful breastfeeding. And then unsupportive hospital practices and policies. Dr. Avis told you that I worked on the Staten Island Hospital breastfeeding initiative for 8 years. I was not successful. I didn't bring it to baby-friendly status. I knocked my head against the wall for 8 years, and I gave up. It's really, really hard to change hospital practice. And is this the real reason that we're failing? The monopoly of education about infant feeding. By the 1940s and 50s, physicians and consumers regarded the use of formula as a well-known, popular, and safe substitute for breast milk. Many were actually told it was safer than breastfeeding. And still today, some physicians who were trained years ago believe that it's easier for the health of the baby because they don't have to worry about supporting mom to make milk. They can just give a bottle and give more if they need more. Financial support from formula companies helps educate our doctors and nurses and even builds newborn nurseries, but you didn't hear that from me. The grants that are given by formula companies to the hospital is one of the reasons that there aren't more baby-friendly hospitals, because baby-friendly hospitals that support breastfeeding aren't allowed to take financial contributions from formula companies. They're also not allowed to give out free formula to families who are leaving the hospital. Now, hospitals give those free gift packs, right? We all got them. I got them, right? Anybody get a free formula pack when they leave the hospital? This is free advertising. It's almost not fair. So anybody promoting breastfeeding is up against major corporations. And if a family is sent home with free formula, they're going to use it. Studies show that that formula does not go to waste. It's used because it's there. Let's try it. Mom has a bad night. She doesn't feel good. She's tired. Somebody says, in a weak moment, let's try the formula. They do it. Baby seems to gobble it down. And that's the end, or the slippery slope. Another controversial topic. Do we talk about the benefits of breastfeeding or the risks of bottle feeding? This is a La Leche handout from the California, WIC. This is a WIC handout, California WIC. And it talks about, it turns it around and talks about the risk of formula feeding instead of the benefits of breastfeeding. Because if we think about breastfeeding as the norm biologically, then we have to think about anything other than that as a risk. So instead of saying that babies who are breastfed have less ear infections, no, actually, it's the opposite. Babies who are formula fed have more ear infections. So the norm is the breastfeeding. So when we look at it that way, it starts your mind thinking about, what are we doing? What are we doing? Now, again, remember what I said before. You know better, you do better. I don't want anybody to feel bad. And remember that I did everything wrong. Okay, keep that in mind, because I never want to make anybody feel bad. And I'm going to get into some kind of icky kind of topics now. But we have to talk about this. You see that? Death and SIDS. The risk of death from disease and sudden infant death syndrome is higher for those who aren't breastfed. This isn't just about immunity. This isn't just about getting the good antibodies or giving the baby something that's better for their gut. This is about airway, right? Sudden infant death syndrome is a sudden and unexplained death of a baby younger than 1 year old. And it's only made when it's unexplained. So if there's another cause, it's not put into this category. And breastfeeding duration of at least 2 months is associated with half the risk of SIDS. In other words, formula feeding doubles the risk of SIDS. You're not going to hear this anywhere because nobody wants to make anybody feel bad or scare anybody. But this is the fact. Is SIDS the ultimate result of sleep-disordered breathing and sleep apnea? We know for adults, sleep apnea and obstructive breathing doesn't always lead to death during sleep. But there's sequelae that happens, right? We heard about Sydney's symptoms, and we know, symptoms of ADHD or anxiety or being tired all day, learning disabilities, all come from sleep apnea? Are infants who are formula fed at risk for sleep disordered breathing and its consequences from birth? So many questions. I don't have any answers, but I'm just putting these questions out there for us to think about and realize